Welcome to the topic seizures. All convulsions are seizures, but not all the seizures are the convulsions. So, what is a seizure actually? It is a disturbance of electrical activity in the brain, and it is caused by the abnormal neuronal discharges in the brain. So, what happened when we say seizure? It acts on the paroxysmal motor sensory and it becomes an autonomic event. So it is defined as abnormal, excessive, and synchronous electrical discharges. If it stays for 5 minutes, it's called as the status epilepticus. And if it is the convulsion, it is called as a motor seizure. But now there is another word, which is epilepsy. So seizure and epilepsy, there is a difference. Epilepsy is a chronic disease of a brain, which is recurrent again and again and unprovoked seizures. So seizures leads to the epilepsy. Two or more unprovoked seizures, they are separated by at least 24 hours. So every 24 hours, you can have the attacks, it becomes the epilepsy. Now, seizures and convulsions, they are non-synonymous. And some seizures, they involve the convulsions, others do not. And if it's a convulsion, the convulsion is always involuntary. It is a violent spasms of the large skeletal muscles of the face, neck, arms, and legs. What are the causes? Many causes of the seizure activity are known, but a few are not known. But the symptom of an underlying disorder can be infectious disease, meningitis, encephalitis, inflammation of the brain, meninges, and inflammation of the brain. Trauma can be physical or chemical trauma. Metabolic disorders like hypoglycemia, hyponatremia, or water intoxication. There can be the causes of the seizures. Others like vascular diseases, which is respiratory hypoxia, carbon monoxide poisoning, cerebral vascular accidents, shock, cardiac dysarrhythmias. There can be a pediatric disorder like the febrile seizures, and there can be a neoplastic disease. These causes can be the cause of the seizures. Now here they're also telling some of these, generally idiopathic, fever, that is febrile seizures. Genetic mutations can also cause head injury, brain tumors or infections, congenital abnormalities at the time of the birth, eclampsia due to the time of the pregnancy complications, and also the psychogenic seizures be the causes of the seizures. Now, epileptic seizures, they are typically identified as the partial seizures, generalized, or the special epileptic syndromes. So if we talk about the generalized seizures, they can be further grand mal or also called as the tonic-clonic scissors. So what happened in this one? These are the phases. The first aura comes, and then the tonic phase comes with the epileptic cry. Now, is the clonic conversion occur? Then first your body is getting up, getting down, your muscles are getting spasms, and then you have a prolonged sleeps. You sleep for might be more than 12 hours, 14 hours, and then is the post-ictal depression occurs after when you wake up. Now, if we talk about the partial seizures, the second one, it is up to the limited portion of the brain. They're also called as the focal seizures. They are further, one is the simple partial seizure that is small and limited focus. One is a complex partial seizure, which involves the sensory, motor, or autonomic symptoms and some degree of altered or impaired consciousness. And it can be preceded by an aura. So generalized seizures, it can be generalized means its entire brain on the both sides. They can also be absent seizures and they can also be the atonic seizures. If it's an absent seizure, it lasts for a few seconds only and the staring common sign, your eyes are your staring. Or if it's an atonic seizures, the episodes are very, very short and stumbling and falling for no apparent reason. When we talk furthermore, the tonic-clonic scissors, it's a grand mal scissors. It's a most common type of scissors, and intense muscle contractions indicate the tonic phase and apnea. The clonic phase is characterized by alternating contractions and relaxations of the muscles. The seizure usually lasts only 1 to 2 minutes, after which the patient becomes drowsy, disoriented, and sleeps very deep. Special epileptic syndromes like febrile seizures, tonic-clonic motor activity lasting for 1 to 2 minutes, rapid return of consciousness, and caused by the rapid rise in the body temperature. 3 months to the 5 years of the age group is more common for this disease. Then a little diagrammatic explanation for these seizures. The simple partial seizure. Patient awake and aware as uncontrollable jerking begins in one part of the body, possibly spreading, and the patient experiences a distorted environment. It may see or hear the things, feel unexplained, powerful emotions, and feel nausea. So if that happens, what should we do? No first aid is necessary unless the seizures becomes convulsive. Provide reassurance and emotional support to the person as necessary. Then if it's a complex partial, it affects more on the temporal lobe. It is usually starts with the blank stare, chewing, and the random activity. Person may be dazed, clumsy, unaware, unresponsive, and mumble. It may run, struggle, flail, fall. Once the pattern established, same set of actions usually occur with each seizure. So that becomes its normal pattern. What should we do? Speak calmly at that time and reassuringly to the patients and others. Guide gently away from the hazards and stay with the person until completely aware and offer to assist in getting them home. Next is myoclonic scissors, the sudden, brief, massive muscle jerks that may involve the whole body or the parts of the body. It may cause the person to spill what they're holding or fall. What should you do? No first aid is necessary unless the patient is injured, and also provide the reassurance and emotional support as necessary. Infantile spasms, it's a clusters of quick, sudden movements and start between 3 months and 2 years of the age. If the child is sitting, head and arms will fall forward. If the child is lying down, the knees will be drawn up with arms and head flexing forward. So again, no first aid is necessary unless injured, and the doctor should be consulted. Next is febrile seizures. It occurs with the fever in the children. Fever, it excites the neuronal activity, and it makes it easy for the large groups of the neurons to freeze simultaneously. Now what happened? The core body temperature increases, alkalosis of the blood occurs, release of certain chemicals, that is interleukin 1 beta. Most are these the tonic-clonic scissors. Stiffness, jerking, loss of consciousness, these are the common symptoms of those. They usually resolve themselves and they're no long-term and they do not harm. Now, what are the do's and don'ts during a scissor? When any type of scissor occur in front of you for any person, stay calm, carefully turn the patient to their sides always, loosen the tight clothes around the neck, cushion the head, note the time of the scissor, seek the medical help if suddenly scissors does not stop. What we should not do not restrain the patient, do not give anything by mouth until the patient regains the consciousness, and avoid crowding and any sharps or the hazards close to the patient. Next is the symptoms of the scissors: confused speech, wandering, muscle contraction, chewing, or blank staring. These all are the symptoms of the scissors. Next is the second special epileptic syndrome is the status epilepticus. We need medical emergency in that. Repeated occurrence of the scissor occurs. Hypoxia may develop. Hypoglycemia, acidosis, and hypothermia can occur. It can cause the brain damage and ultimately death. So this is the status epilepticus. Very important. We need medical emergency right away. How do we can manage the status epilepticus? We give the treatment involves the IV administration of anti-seizure medications, and during the seizure activity, steps must be taken to make sure to maintain the airway for the patient. Now, effective seizure management involves the strict adherence to the drug therapy. So what is the anti-seizure pharmacology? It dependent on the patient's presentation, its medical history, and associated pathologies as well. Effective therapy usually obtained with one drug at the start, and the seizures can occur due to the drug cessation. When you stop taking that drug, the seizures can occur again, or it can be discontinued. The drug can be discontinued, should occur over every many weeks. Now, they are the suggested drugs for the management of the specific types of the seizures. For example, we have the partial seizures, absent seizures, tonic-clonic, and myoclonic. So the drugs that they potentiate the GABA, none of the drugs they potentiate, like it's clobazam. Clobazam, it is good for the partial seizures, absence, tonic-clonic, and myoclonic. If it's a gabapentin, it is good for partial seizures, not for anything else. Phenobarbital only for the partial seizures. Primidone only for the partial seizures. And tonic-clonic. Topiramate drug is used for the partial seizures, absence, tonic-clonic, and myoclonic. So in these two drugs, clobazam and topiramate, these both drugs are good for any kind of the seizures, partial, absence, tonic-clonic, or myoclonic. Next is many causes of the seizure activity are known, a few are not. Like again, we have the partial seizures, absence seizures, tonic-clonic, and myoclonic. Carbamazepine, these are all drugs which are Hyden twins classification. So carbamazepine is good for partial seizures and tonic-clonic. Lamotrigine for partial seizures, absence, tonic-clonic, and myoclonic, everything. And levetiracetam is for all the seizures. Oxcarbazepine is only for the partial seizures. Phenytoin is only for the partial, tonic-clonic. Valproic acid is for all. Then comes the another class is the succinimides. Ethosuximide is only good for the absence seizure. So these two charts explain which drugs is good for which kind of the seizures. Now, anti-seizure pharmacotherapy is directed at controlling the movement of electrolytes across the neuronal membranes or affecting the neurotransmitter balance as well. What is the goal and action of the pharmacotherapy that we give to the patient? It suppresses the neuronal activity just enough to prevent the abnormal or repetitive firing. And the three general mechanisms by which the anti-seizure drugs work: number one, stimulating an influx of the chloride ions, neurotransmitter gamma aminobutyric acid, which is called as GABA, delaying an influx of the sodium ions, and delaying an influx of the calcium ions. By increasing the effects of the gamma aminobutyric acid in the brain, drugs reduce a wide range of the seizure types. So number one, GABA is a primary inhibitory neurotransmitter. It suppresses the firing of the neurons. Barbiturates, benzodiazepines, and some other reduce the seizure activity by augmenting the action of the GABA, like by augmenting the action of the neurotransmitter GABA. Now, GABA-related drugs, it's usually used in conjunction with other medications. For this one, this model is telling up for a gamma aminobutyric acid receptor chloride channel. The chloride selectively filter allows the channel to open exclusively to the chloride ions when the GABA, benzodiazepines, or the barbiturates, they bind to the cellular receptor. You can see this triangle, GABA, red ball, benzodiazepine, and the green is showing barbiturates. And they all are trying to attach exclusively to the chloride ions to the cellular receptor. These greens are the cellular receptors. Some anti-seizure drugs are similar to the structure of the GABA. So we make the drugs which has the same structure like the GABA, or they may potentiate the GABA indirectly. After the influx of the chloride ions, the net result is inhibition of the neuron's action potential and the suppression of the neuron's firing rate. Next is the Hyden drugs. So what do they do in the body? So Hyden and related drugs are effective in treating the partial seizures and the tonic-clonic seizures. They dampen the CNS activity. They delay the influx of the sodium ions across the neuronal membrane. And the sodium channels are not blocked, just made to be less sensitive to decrease the likelihood for an action potential. And the drugs in this group may also affect the threshold of the neuronal firing. And they may interfere with transduction of the excitatory neurotransmitter, which is called as glutamate. Dilantoin, Phenytoin is the first drug as in Hydentoin. It is the oldest and the most commonly prescribed anti-seizure medication. Very important to remember. First-line drugs in the treatment of the status epilepticus is the Dilantoin, and Phenytoin-related drugs have a mechanism similar to that of the Hydentoins as well. Next, for this, we have the drugs as Hydentoins is the carbamazepine, tegretol, oxcarbazepine, trileptal, and valproic acid, depakine, depakote, and lamotrigine. Next class of the drugs is the succinimides. These are used to treat the absence seizures. So they affect the calcium influx at the neurotransmitters, hormones, and membranes, and the calcium is fundamental in neuronal transmission. They delay the influx, thereby increasing the electrical threshold and reducing the probability of an action potential. For example, zerontin or ethosuximide. Now, again, there is the key drugs for the treatment of the seizures. We use barbiturates, it's phenobarbital, primidone. We use benzodiazepines, this is clobazam. We use GABA derivatives, it's a gabapentin. We use Phenytoin-like drugs, it's carbamazepine, divalproex, oxcarbazepine, valproic acid. In Hydentoins, we have Phenytoin, and in other miscellaneous drugs, we have lamotrigine, levetiracetam, and topiramate. Succinimides, we use the ethosuximide. Now, we did what in the whole chapter is the seizures are uncontrolled neuronal brain discharges whose reasons are not all known. And the seizures are categorized as partial, generalized, or the special epileptic syndromes. The seizure management involves the pharmacotherapy to control the movement of electrolytes, thereby increasing the electrical threshold. The mechanisms involve the chloride ions and the GABA, desensitization to the sodium channels, and blocking of the calcium channels. That finishes with the topic seizures. Thank you.